This is the ECG machine. It is used to capture the electrical activity of the heart. This brand is Philips, as you can see. Okay, this is what it looks like. Let me turn this on. So that's the on button right there. So the first thing you do to use it, make sure it's plugged in. Okay, make sure it's plugged in, and then these are the leads right here. See them? These are the leads. See, it's color coded. So it is called the 12 lead ECG, but there are 10 leads. So 12 leads because it gives you 12 angles of the heart, but actually there are 10 leads. 4 leads go to the limbs, that's the upper limbs and the lower limbs. Then 6, the other 6, V1 to V6, they go on the chest. We'll talk about the placement in a bit. So you see it's labeled. This is V2, this is right arm, this is left leg, sorry, this is right leg, this is V3, this is V6, V5, and so on and so forth. So this is what you clip. There are some stickers you put on the chest. When you put those stickers, then you clip this on the stickers right here, like this. You clip them on. Okay, so it has a cubicle here. As you can see, the papers are here, ECG paper. Then these are the stickers that go on the chest. They look something like this. So they have like stickies. You stick it on the chest and then you clip on the leads on it right here. This is where the paper goes in right here. Remember this part, when you are putting it in, you just slide it in like this, and this part that has a hole should be facing this way, and then you make sure you pull it out like this, you know, so that it is something like this, not hidden inside or completely gone. What else? Okay, let's go to the main thing. So this one is touch screen. You can work with these buttons here, or you can work with this one. So you turn it on here. This button allows you to put your patient's data in the computer. So you use these buttons, these you know, just like a regular computer or a typewriter if you like. So you spell the patient's name, put the patient's data, name, date of birth, age, sex, you know, all those things. You can type them in here. You can use this to do page up and page down sideways, just, you know, like a regular keyboard. Yeah, that's what it's like. So you turn it on here, you also turn it off here. You can put your patient's ID here. Some of them actually have a scanner where you can just scan the patient's armband, and it will automatically feed the computer with the patient's data. Then after you attach all these leads, there will be a tracing here. So when you are comfortable with the tracing, if it looks okay to you, no artifacts, nothing odd, just a regular tracing, then you press this button right here. That's the ECG button. You can also use this, as you can see, you can use this right here, ECG button. If you want a rhythm, you can just press this and it will bring it out. Then this is another place where you can press the button. Let's see, ECG. You just press this and it will print out the ECG for you right here.